Hello, I'm Jessica Kushner, genetic counselor at Oregon Health and Science University in Portland, Oregon. I'm pleased to present this video on behalf of the GenTAC Alliance to review the use of genetic testing in the care of patients and families with aortopathy. Aortopathy refers to a group of conditions that affect the aorta, the main artery that carries blood from the heart to the rest of the body. These conditions can weaken the walls of the aorta, leading to an increased risk for aortic enlargement, aneurysms, or dissections. This video will primarily focus on the genetic conditions of the thoracic or upper aorta, though the lower abdominal aorta and other blood vessels can be involved in thoracic aortic conditions. Genes are the units of instructions in our body cells. Each gene codes for a specific instruction or function in the body. It is thought that humans have about 20 to 30,000 total genes. Changes or variation in the DNA code of certain genes have been found to increase risk of developing thoracic aortic disease. These gene variations can affect the structure or function of the aorta, making it weaker or more prone to problems. Approximately 1 in 5 people with thoracic aortic disease have a genetic form of the condition. Genetic testing is a lab test that is typically done on a blood sample, saliva, or inner cheek swab sample. Aortopathy genetic testing looks for differences in the DNA code of genes that have been associated with aortic disease. In the United States, such testing is available in specialized labs when ordered by a healthcare provider. Thus far, about 30 or so different genes have been associated with risk for developing thoracic aortic disease. In some cases, the genetic aortopathy also involves risk to develop problems in other parts of the body, such as the eyes and joints. These conditions are referred to as syndromic aortopathies and include conditions such as Marfan syndrome, Loeys-Dietz syndrome, and Ehlers-Danlos syndrome. A non-syndromic genetic aortopathy means the condition affects the aorta and other blood vessels, but without involvement of other parts of the body. Most genetic aortopathies follow a pattern called autosomal dominant inheritance. In autosomal dominant inheritance, each biological child of a person with a genetic aortopathy gene variant has a 50% chance to inherit the genetic risk factor to develop aortopathy. This also means each child has a 50% chance they will not inherit such a genetic risk factor. These risks are the same no matter the sex or gender of the parent or child. Genetic testing is an important part of the diagnosis and care for people with thoracic aortopathy. Genetic testing can provide important information for your medical providers and can aid in reducing risks of the most serious and emergent complications of aortopathies, such as an acute aortic dissection. Identifying the specific gene responsible for a person's aortopathy provides an accurate diagnosis and guides medical provider decisions on treatment and other interventions. Genetic testing can also identify at-risk family members, allowing for early screening and proactive care, even prior to any symptoms. As noted in the recent AHA-ACC guidelines for the diagnosis and management of aortic disease, it is appropriate to offer genetic testing to young individuals with thoracic aortopathy, those of any age with suspected aortopathy syndromes, families with one or more affected relatives, and to the relatives of a person with aortopathy in which a causal gene variant has been identified. There are some important limitations to aortopathy genetic testing. Test results can be negative or inconclusive, and such results do not necessarily rule out a genetic cause or risk for relatives, as we expect that additional aortopathy genes are likely to be identified in the future that we don't know of yet. So with negative or inconclusive genetic test results, it is still recommended that close relatives undergo aortic imaging to look for any signs of asymptomatic aortopathy to help with early detection and treatment. Additionally, it's important to know that a positive genetic test can predict the severity of the condition or what specific symptoms a person may expect in the future. Given the limitations and possible implications of genetic testing, genetic counseling is strongly recommended before and after testing to make sure that you are the right person in your family to get the genetic test, that you're getting the correct genetic test, and that you understand your results and what your results mean for your ongoing care and your family members. In conclusion, genetic testing for aortopathy is a powerful tool that helps identify individuals at risk, guide treatment decisions, and provide valuable information for family members. If you suspect you or your family may be at risk, consult with a genetics healthcare professional to discuss the benefits and considerations of genetic testing. Additional information can be found at the GenTAC Alliance website, as well as at the National Society of Genetic Counselors website. Thank you for watching this video. I hope you found it helpful. I wish you and yours the best in health.